Hello, welcome to Arthritis at Home. You're joining us for part 2 of a special episode with our guests, Dr. Maria Westby and Cheryl Koehn. Cheryl, as many as you know, is president and founder of Arthritis Consumer Experts. Dr. Westby is a physical therapist, the Maria Arthritis Program, and clinical associate professor at the Department of Physical Therapy at the University of British Columbia. Maria is also an associate member of the Center for Hip Health and Mobility. Welcome to you both. How are you doing today?
Great, thank you.
In the first episode, or first part of this episode, we sort of focused in on Cheryl's personal experience and her 12-month post-surgery rehab with her new knee. And Cheryl took us through sort of the ups and downs of that process, but mostly I think a very positive experience that Cheryl had, thanks to her sort of adherence and self-discipline and following the exercise and treatment program that was prescribed by her provincial arthritis program. Today we wanted to talk at a sort of more broader level across Canada what the state of total joint replacement rehab is in Canada. Cheryl, you did refer to the provincial program that you went through. Just a reminder to our viewers that the delivery of these programs is a provincial responsibility, so that we have all sorts of different programs in place across the country. Dr. Westby, I guess the first question is there sort of a consistency or standard that all of these programs are striving to meet?
The short answer is no. And you're right. So these the ways that we deliver healthcare, well funded federally, is delivered provincially. But even within a province, every province has a slightly different way of doing it. In BC, we have health authorities. In Alberta, they have health regions or zones. Ontario has different sort of breakups of the into regional sectors. In BC, every region is doing something different. So there is no consistency. Are we all striving to a consistent approach or standard? Absolutely. And I'm hoping that's what some of my research is going to lend itself to. So some provinces on a more provincial level are ahead of BC in terms of having a overarching sort of principles and guiding pathway. Alberta has a hip and knee replacement clinical pathway from the time someone decides that works with their surgeon to determine they are a candidate or ready to have a hip or knee replacement, right through the hospital stay and the post-op and the monitoring of care up to a year afterwards. And that's on a provincial level, and then it's delivered by local clinics in the different regions. Ontario also has some health quality standards and best practices that is meant to guide their entire provincial offerings of pre-op and rehabilitation after hip and knee replacement. I can't speak to whether or not how successful they are in achieving those goals or those standards of care, but it is a guiding sort of principle, and every province takes a slightly different approach. My work is to look at sort of the minimum standard of care that each province can strive for, and the Ontario one actually, which is really nice to see, their standards of care are very similar. Complementary to the some of the standards or indicators that we develop, but it's still a work in progress across the country.
I'm sure Cheryl's thinking the same thing I am from a ACE perspective, and that is you need a report card. And something that ACE is known for in terms of a measuring tool to evaluate reimbursement coverage for medications in every province. And certainly this unlevel playing field that you're describing, if you're on a province that's falling behind or is not, if you're a patient there not receiving the same care, there's a real health equity issue there that probably needs to be addressed. I'm not sure, Cheryl, if you had any other comments about that.
Yeah, just as a consumer, as a patient who's gone through a total joint replacement, One of the things that strikes me as I listen to Dr. Westby and other her colleagues talking about care and the pathways, for example, having a pathway sort of system or plan and implementation is really helpful to patients, because you can look at where you might be going, where you're supposed to go. And inherently you say, oh, I get where I'm at on this pathway. And when something doesn't happen for you on the pathway, you know it hasn't happened. And then you can practice self-advocacy. You can ask why that part of the pathway didn't, appear for you, or why it wasn't as good. If it's a restaurant that was supposed to get 5 stars and the food was crummy, you're kind of going, what gives here? That rating wasn't all it was cracked up to be. So I think the notion of national sort of standards or a pathway that every patient can see and understand when they go into it is really helpful to them in terms of what they get out of their surgery. Like knowing where you're supposed to go and what you're supposed to get from the system is super helpful to us as patients.
Dr. Westby, over the last 5 or 6 months during the pandemic, have these sort of varying levels of treatment and care, have they been amplified during the pandemic?
You mean the differences in care?
Yeah.
Yeah, sort of the equity. Yes, I mean, I think, and again, I can't speak across provinces. I've shared some of the experience with colleagues from across different provinces, but how each province or region has dealt with it. I think we've all ramped up or tried to deal with the closure of hip and knee replacement surgeries and the lack of ability to provide in-person care differently. Some provinces were already further ahead with having a tele-rehab approach, and so that was fairly seamless for them to be able to transition patients to that, and some were already offering that as part of their care pathway. In BC, I know some private practice clinics were already offering that, and again, they could continue that, whereas other places were learning. It was a very steep learning curve for us as therapists to suddenly switch gear and deliver care in this way, even though there's great evidence for hip and knee replacement that it can be quite effectively delivered with similar outcomes and quite high patient satisfaction for the right people. So you probably saw some inequities or further inconsistencies, as you say, based on whether or not a province already had virtual health as part of that sort of planned pathway.
One of the focuses of your research is the quality of TJR rehab, but specifically quality indicators. I wonder if you could explain to our viewers what exactly that term refers to.
Sure. So quality indicators are like a measurement tool. So we have guidelines to guide our care, but they're fairly generic. Like everyone should receive an exercise program, and there's good evidence to support that. But from a patient and a provider or a clinician perspective, it's lacking the details we need to know, well, exactly what should that exercise look like and when should it start and how often should it be. So quality indicators kind of take it the next level and do what we call operationalize it, or provide the detail behind some of those more general recommendations. And they reflect the minimum standard of care a patient should receive. So they could receive much more than what these statements or indicators reflect. But at the very least, patients should expect this level of care or this type of program or these type of assessments to be done. And for our work, we develop these quality indicators across the continuum of care. As Cheryl said, a lot of her preparation for surgery started in that pre-op, or what we call prehab phase. There's so much you can do before surgery. So we have indicators that reflect that preoperative stage, which for some provinces is several months, if not up to a year, unfortunately, the wait time. For the very short acute care stay, which is anywhere from 1 to 3 or 4 days. So a very short interval, and then the post-operative phase. And there's different types of care, interventions, education, assessments that we should be doing as rehab providers during each of those phases.
I know you have been involved in a lot of research projects. You're currently conducting some. I wanted to know if you wanted to highlight some of those for us, and maybe particularly about the QUICK and EQUIP project you're working on currently.
Sure. Thanks. It's a great opportunity. I'm really excited. Cheryl is a co-investigator, a partner, a patient partner on this work, and we can't do it without our patient partners. It's what we've been focusing on for the last several years is developing tools, resources, guides. You spoke about a scorecard. We're calling it a patient passport that allows patients to track the care they receive, the discussions they have, to record their expectations. As Cheryl noted, having expectations met is a big part of your recovery and your satisfaction with your recovery. So we developed a toolkit of resources for clinicians, and that's called QUICK, and it's a fancy acronym, but basically it reflects the fact that clinicians wanted something that was quick and easy to use to implement into everyday practice.
Sounds familiar.
That does sound familiar. It's got to fit in with this care pathway if you expect me to start using it in that. And it will have videos and resources and checklists and audit tools so they can look at the care they've been providing to patients, and a number of other different resources. For patients, it's called EQUIP, another fancy acronym. But what patients told us through focus groups several years ago is they wanted resources and tools that could inform them, help them self-advocate for themselves, to monitor their care, and equip them with the knowledge and resources that they needed to have a successful journey from pre-op through the hospital stay and post-operatively. So those resources, again, there's videos, there's this health passport where they can track their journey, communicate with their healthcare provider, as well as give them some strategies around sharing their expectations and needs with their healthcare provider. And as Cheryl noted, being able to track, whether they received a particular intervention or treatment or assessment that they should have based on the care pathway. It gives them a way to monitor that and to open up that conversation.
Cheryl, did you want to provide any real-time patient input?
Yeah, I just can't emphasize enough how important this project is, QUICK and EQUIP. Because of my involvement in EQUIP, I knew what a few of the key milestones in hospital, so the rehab that I received in hospital, which is really focused on not just managing yourself in and out of hospital bed the couple of days you're there, but obviously preparing you to be discharged from hospital and getting you ready to enter your own home environment. And because of EQUIP, I knew what was sort of a few of those milestones in hospital. And at some point, I recall during day 2, something was supposed to have happened, and I hadn't seen a person who was supposed to have gone through some of these things with me. And I said, well, am I not supposed to see someone and it's all because of EQUIP that I even knew to ask that question. So, you don't know what you don't know. And when you're in the middle of kind of struggling to figure out how you're going to live your life with this new knee and a lot of pain initially, learning how to make it work for you, and you don't have some key pieces of information, think about the potential downside for for outcomes. It's, maybe your percentage of achieving a better outcome go way down if you don't have the knowledge you need or the skills you need to actually do what you need to do. And I live in a place where I have to go up and down stairs just to get to my bathroom, to my washroom. So this is, getting up and down stairs was one of those milestones in hospital that you have to sort of accomplish. You have to get over that milestone or cross over that milestone in order to be discharged with confidence. So some of these quality indicators that Dr. Westby talked about, they seem like no-brainers. They seem like really simple. But if both provider and patient don't have that common knowledge, the system or the outcome could break down pretty easily. And even just with one piece of knowledge. But if you're missing several pieces of knowledge, you know, it all falls apart. So this project, Quick and Equip, these toolkits, and Dr. Westby's body of work over the last few years in this area about quality is vitally important. Otherwise, I don't know how we as patients could self-advocate as effectively as we can with these toolkits.
So for our viewers, Dr. Westby, who are interested in finding out more about the EQUIP toolkit, where can they go? Where can they find that information?
Right now, the toolkits are in a research phase, so they're not available publicly. We want to investigate the impact on actually changing the quality of care. So we are applying for funding to do a study where we'll look at making those toolkits available to patients and to clinicians to marry the two. It's, you know, the push and the pull, as we often say in research, of giving both parties information, and hopefully they'll collaborate on that and push each other to follow these indicators. And we're looking at to see if that has an impact on outcomes from both a patient perspective as well as the provider's judgment of that. To look at their experience of going through this journey, their satisfaction with the outcomes, and also to see if clinicians use it. Do they find these toolkit resources helpful? Does it help to inform their care? Do they feel it's a good experience? And we need to do that research first and make any changes that are needed before we can put these toolkits out there to be available on the website. But they will be housed on a website, and they will be freely available to clinicians and to patients eventually.
At the end of this episode, we are going to run a series of links for our viewers to get more information about post-TJR rehab. So thanks to you for supplying some of those links. Thanks to you for your time today, Dr. Westby, and to you, Cheryl. That completes part 2, and we welcome our viewers to join us again next week for another episode of Arthritis at Home.
Thank you. Thank you, Dr. Westby.
You're welcome. Pleasure.